Hello, welcome to the Nurse Scrub Club, where we make learning fun and engaging. Welcome back to the club. Today we'll be discussing normal saline versus lactated ringers, why we use them, when to use them, and when to stop them. By the end of this video, you'll know which scenarios call for normal saline, which ones call for lactated ringers, and why choosing the right fluid can make a big difference in patient care. Know the difference, treat with confidence. Let's keep it simple. Normal saline, also called 0.9% sodium chloride, is a fluid made of water plus sodium and chloride. It's often used to help expand blood volume and replace fluid losses. Think of normal saline as the basic, dependable workhorse fluid. It's commonly used in hospitals for dehydration, low blood pressure, IV flushes, and fluid replacement. Now let's look at lactated ringers, or LR. LR contains water too, but it also has multiple electrolytes: sodium, chloride, potassium, calcium, and lactate. LR is often considered a more balanced fluid because its makeup is closer to what the body naturally has in circulation. So in simple terms, NS is basic and widely used, while LR is more balanced and often preferred in certain fluid loss situations. Section 2. When do we use them? Normal saline is commonly used when a patient needs quick volume support. You may see it used in dehydration, hypovolemia, hypertension, and when giving certain IV medications or blood products. NS is also commonly chosen because it contains no potassium and is often seen as the safer pick when you want a simple fluid. Lactated ringers is often used when patients have lost a lot of fluid and need something more balanced. You'll see it in trauma, burns, and surgery. Because LR contains multiple electrolytes, it may help replace losses in a way that is closer to the body's natural fluid balance. Section 3. Signs and symptoms. So what signs tell us a patient may need fluids like NS or LR? Watch for dry mouth, thirst, dizziness, and low urine output. If the body doesn't have enough fluid, the patient may become dizzy or tachycardic. If fluid loss becomes severe, watch for confusion, cool, clammy skin, very low blood pressure, and signs of shock. Fluids may need to be given quickly. Section 4. Interventions and danger zones. When giving NS or LR, the nurse's job is not just to spike the bag and walk away. Assessment matters. Before starting fluids, assess vital signs, lung sounds, mental status, and urine output. Then continue reassessing after fluids are started. Should fluids run on a pump or wide open? Stable patients usually use a pump, but in emergencies like shock, they may run rapidly per order. Too much IV fluid can lead to fluid overload, especially in patients with heart failure or kidney disease. Watch for shortness of breath and crackles. Watch for increased work of breathing, swelling, and a sudden decline in oxygen status. Always look at the whole patient, not just the bag. So when do we stop? Fluids may be slowed or stopped when blood pressure and urine output return to normal, or if signs of overload appear. Section 5. Patient teaching. Tell them to report symptoms like trouble breathing, swelling, or pain at the IV site. Clear warning signs. No medical mystery required. Mini quiz time. Question 1. Which fluid contains multiple electrolytes and lactate? The answer is B. Lactated ringers. Question 2. Which finding suggests fluid overload? The answer is B. Crackles and shortness of breath. These are warning signs. Question 3. In an emergency with major volume loss, fluids may be given? The answer is B. Wide open, per order, and protocol. And that's your breakdown of NS versus LR. Join us in our next topic on oxygen devices with RN Boateng, and don't forget to like and subscribe. Bye for now. See you in the next Nurse Scrub Club meeting.